Hi, my name's Beth Hash. I'm the office manager for Aegis Women's Healthcare here in Bloomington, Indiana. We have been one of the practices that started using the clinical messaging when it originated, have used it and really thought that it helped us a lot. To me, the benefits of the clinical messaging, they're probably numerous enough that I can't go through all of them, but number one is the accessibility to the patient's labs. Back whenever we didn't have the clinical messaging, you would have to call medical records at the hospital, obtain them, wait for them to be faxed. Now you can just go in and they're there. Plus our doctors also can access these whenever they're at the hospital, different locations that help also with the doctor end of it. With my medical records, I think probably on comments from them, the thing about this is that's so advantageous is that they can again go in and obtain something and interface it with our EHR, which is paperless, which we all are trying to work towards. One of the advantages also, I think, of the EHRs and the clinical messaging is, especially for our practitioners, is the fact that they can access things from wherever they are. They're on vacation, they get a call from a patient, or they're on call and they get a call from a patient, and they have the ability to go in and check the chart, know what's going on, be able to figure out what needs to be done immediately, which makes a huge difference. They're not waiting for the office to open, hunt down a chart. This makes a tremendous difference, I think, in the helping to speed up the care of patients. Plus, like I said, the doctor can also keep up on his work and things do not pile up on his desk like you would never. In the past, you would have someone on vacation and you could have as many as 50 charts sitting on a doctor's desk that was facing him when he got back. Don't have that anymore, and that's tremendous help. Clinical messaging actually forwards our patients' lab results to our EHR system, and then it actually populates into the patient's chart. It also will populate the face sheet of the patient and the summary. So it's just has been a tremendous help to us there. But to be quite honest with you, the clinical messaging I can see would even be a huge benefit if you didn't even have the EHR, just because you are receiving those on a regular basis. You know where they are, you can go in and obtain them, and it makes a big difference. The support through HealthLink has been tremendous. They're always accessible. One of them will get back to you within an hour. They usually seem to be able to help us with whatever problem. Matter of fact, they kind of have spoiled us because they do try to get back to you, and then when you go to work with someone else, they aren't quite as easy to work with. So that I cannot say enough about.